this morning's For Your Community segment, we take a look at the opioid crisis from a bit of a different angle. Today's guest tells us there's a crisis actually developing within the crisis.
Jim Gorske, the executive director of AdCare Educational Institute, is joining us to discuss. Good morning to you, sir. We've seen the headlines in recent days from the Trump administration addressing this through a commission, saying that this is a national emergency. You've been working with the Department of Public Health for years on this crisis.
Correct. We've been partnering here at AdCare Educational Institute with the Mass Department of Public Health Bureau of Substance Abuse Services to train counselors, social workers, nurses, physicians in information, knowledge techniques, evidence-based practices to address addictions and substance use and addictions in general. More recently, with the turn of events and hopefully more resources coming from the federal level to address this opiate crisis, it puts a strain on already a dissipating workforce. We've noticed over the last 10 years an aging out of our workforce. A lot of younger people aren't choosing this as their course of study in colleges and throughout the pipeline in the educational system.
Hence the workforce crisis.
Hence the workforce crisis.
So how are you tackling that?
Well, I'd like to know some answers to that myself. We have been trying to put more training on the street, more dedicated interventions in terms of addressing curricula in schools, training recovery coaches and other type of allied health professionals to help deal with the opiate crisis and other addictions. But we're really going to need to address some of the issues that are having people leave the workforce. Namely, we're aging out. We need to do something about compensation. This is not the highest paying field in the world. Well, with this new money, maybe we start to address issues of compensation for the workers who do this work. People are opening treatment programs and not able to staff the treatment programs. So this crisis is going to take more than just throwing money at it and opening more beds. If you can't staff the bed with a qualified behavioral health workforce, it's not going to do anyone any good. So our role is to keep the people that we have through ongoing training and education and continuing education, attract people to the field and help them get the educational requirements that they need to get certified and licensed in the addictions field.
We only have a few moments left,
Yes.
but is there anything that people can do within their own community? Is it calling their congressman and saying, we need your support on Capitol Hill with this issue?
Well, I would love to reach out and say, yeah, tell people to pay substance abuse counselors more. But the biggest thing I think that I'd like to leave you with is the resource that we've got that the state has put together is a website called the careersofsubstance.org. And that's all you need to type in, careersofsubstance.org. And that is a place that people can go and learn everything about becoming a counselor, becoming a recovery coach, how they can help, what the standards are, where to look for jobs, career paths. It's a very robust website, and it links to all of our training opportunities and other training opportunities throughout the state. And I would encourage people to go there, spend some time, and to share that website with other folks.
Certainly a good way to address what's now been deemed a national emergency, so we certainly appreciate you sharing that message with us today, Jim.
Jim Gorske of the AdCare Educational Institute, thank you for taking the time
Thanks for having
to be here
me.
with us.